Over the past month, more than 40,000 Ethiopians have fled clashes in Tigray to camps in eastern Sudan. Those arriving are placed in 3 camps in the cities of Kadarif and Kasala. 32-year-old Isfai Ali and his pregnant wife fled Humera to get away from the fighting, but now face a COVID-19 outbreak in this camp.
In Humera, some cases with coronavirus were discovered, but the government controlled it. Because of the internal conflict, I fled to Sudan, but I'm so worried about the spread of COVID-19 here in the camp due to the living conditions, room, and shortage of water.
Social distancing is difficult in the camp, where at least 6 refugees stay in each small tent or room. Health workers warn refugees of the coronavirus risk and teach them methods to prevent the spread of the virus. Isolation centers are also being built.
The high population and the big number of refugees represent a risk factor for the spread of the virus. There is a possibility that some of the suspected cases fled isolation centers in the war zone and came to the camps.
A second wave of COVID-19 is sweeping across Sudan, which reports at least 17,000 registered cases. The government has shut down universities and schools and is considering whether to impose more restrictions. The UN Refugee Agency is calling for more international aid to deal with the crisis. Refugees are trying to adjust, constructing small markets inside the camps and close to the hosting villages. Meanwhile, the Sudanese government is setting up a new refugee camp 250 kilometers from Khartoum to help ease overcrowding in the existing camps. Naba Muhiddin for VOA News, Umrakuba Camp, Al-Qadarif.